It is 8:26 on a Friday morning, and I'm just now getting ready to grab my coffee cup because I left it in the car, and I'm going to be getting Raiden up very soon so that he can get ready to go to the babysitters. So that's our plan. I did my makeup and my hair today. I haven't been doing it very much, honestly. I've just been really tired, just been focusing on work mainly and just trying to get up and ready and go and sleep in a little bit. So I'll see you guys in a little later. Oh, that is not full enough. Round 2. There we go. That's better. The sugar. Like this much. Don't judge me, but a fork is not long enough, so I have to use this thing. Good morning. Did you sleep well? Huh? You just waking up? What are you eating? Cereal? Yeah. I haven't been eating breakfast too often, but my stomach isn't feeling well, and everyone in the household has got the like sickness that Raiden had got. So I think it's like the 24-hour flu maybe. And they're not feeling well, so I'm definitely gonna try to put something in my stomach to make sure I don't get sick. I ended up drinking some emergency, it's like this powder pack, and I think that might have helped me the other day so that I didn't get it, but my stomach is definitely feeling upset. So we'll definitely see how these next couple of days go for me, but everyone else isn't feeling well. Raiden is feeling better. He hasn't felt like bad since he took a nap and after he threw up and everything, so now everyone else is not feeling well. So we're headed to the babysitters right now, and guys, I hope I don't get this like stomach flu because I can't afford it. I can't afford it at all. I need to work this whole week, period, because just taking the day off when Raiden was sick was bad enough because it was our slow week, and slow week just means that there's less houses that we need to go out and inspect. So that was not a good week for me. So I can't afford to get sick. So I'm probably gonna go to the store and pick up some ginger ale because that's my favorite, and hopefully that'll help ease my stomach a little bit. I didn't eat any crazy cereal this morning. I just had some Cheerios and probably too much sugar, but I'm just gonna go with it, and I just hope that my stomach is at ease for the rest of the day and it doesn't act up anymore. So we're headed to the babysitters, and I just hope this day goes good because I need to work. Babysitters, say hi, YouTube. What is with you these days? You don't want to talk to them? No? You want to talk to Daddy? Okay, we'll video chat Daddy, okay? Yeah, we'll video chat Daddy. Yeah. I have to put lotion on my tattoo, and it's not looking good at all, guys. It's in the scabbing phase. So the ink is starting to go out, the excess ink, and I don't think my body is reacting very well to a tattoo. So that's how it looks right now. So guys, I ended up buying a coffee this morning instead, and I got a Verner's, which is my favorite. I do like the regular ginger ale, but I'd rather have Verner's, definitely. It's like my top 10. It's like my very first drink that I'd like to have if I'm not feeling well. Second would probably be Sprite, and then the bottom would be like that clear ginger ale, I would say. But like I said, I got another coffee because the one I had got really cold, and honestly it didn't taste that well because I used milk and didn't have creamer and it was cold. So I just finished getting gas. Now I am ready for work. Did you have a good day today?
No.
No, you didn't have a good day?
No.
No. Okay. No.
No.
What'd you do?
Nothing.
Oh, you played?
I played some.
Oh, okay. So I told you guys that I only feed Raiden at bedtime, but I'm not feeling good today. I think I might be getting a slight stomach bug, so he's feeding right now, which is not usual because I'm trying to wean and only do night times. But in order for me to take a nap, this is what it comes to. So we're doing that now so that I can take a nap because I feel awful, and I think that if I get at least an hour nap in today, then I'll feel perfectly fine. Okay guys, so I am doing this vacant interior for my job, and I'm looking for the hot water heater in the furnace, and guys, guess where it is? Check this out. That's so freaking cool. Let's go check it out.
Be careful, honey.
Holy shit. James. Holy shit, that's so freaking cool. Guys, look. The stairs lift up. That's so crazy. Okay, I gotta do my job, so I'll talk to you guys later. Woo! Hey guys, welcome to my channel. So today's topic is gonna be about my struggle with infertility before I had surgery. So first and foremost, I just wanna say that I really appreciate the 28 subscribers that I have, and I hope that you are enjoying the video content that I am creating. And I'm really looking forward to developing my YouTube content so that I can come to you guys with great videos. And if you guys are wondering why I usually do my YouTube videos on my bed, it's because it's my safest, like most comfortable place, and I really feel connected with you guys and I can be myself freely. So let's get into this video. I want to talk about what was going on when I met my son's father, and the kind of signs and signals I had happen which caused me to realize that something was wrong. So to get into that, I ended up needing a surgery, and what led to the surgery was that I believe that I had a miscarriage because there was this one day vividly that I can remember. I knew I was possibly having a miscarriage at that time because my migraine was so bad. I ended up bleeding, and I had some sort of like discharge. I remember it was like a gummy discharge, but that time was not recognized as a miscarriage at all because it was way too early on, but I believe it was a failed pregnancy. And then goes on, I ended up having a positive test, but then my hormone levels weren't high enough, so there was an issue there. Okay, so then I had went to the doctor's office because I was experiencing this pain in like my lower like stomach, like uterine ovary area, and it was like a sharp pain. And with that pain, it really concerned me, so I went to the doctor's, a gynecologist, and they did an ultrasound, and they saw something that looked like they said a dermoid cyst. If you don't know what a dermoid cyst is, it's a cyst that like develops, I guess, hair and teeth and even eyes. For some reason, I don't exactly know the science about a dermoid cyst, but it turns out when I had the surgery, which was a laparoscopy, and a laparoscopy is like some metal arms that they put in like into your stomach with an incision, and they kind of use a camera and look around and see. They would remove the cyst at that time if need be with those items. And during that procedure, before that procedure, sorry, I'm all over the place. Before the procedure, they had told me what they were gonna do, and they were gonna go inside and remove the cyst, or if it was too severe, like what I would want to happen and everything like that. But for some reason in the back of my mind, I don't know why, but I was looking up a lot on Google, and I had told them, if my fallopian tube is blocked, unclear it, or do like a tubal ligation or something. It was something like that, and that just popped in my mind as a question to ask them. So then while I was in the procedure, they ended up having to do a tubal flush because I had this blockage inside of my tubes. And if I find the photo of this blockage, I'll put the picture in this video because it was so scary. Like my tube was about this like big, and it like the size of like a big cyst, but it was inside my fallopian tubes. So they had to do that flush. And then after that flush of liquid or scarred tissue or whatever it may have been, I was able to get pregnant with this little boy. And I was really scared. When I was pregnant with him, I was really scared and worried because they had told me from tests before that my progesterone levels were low at my other pregnancy. So I ended up having to take like progesterone suppositories every, like, I forgot how many times I had to take it, but I had to take a whole bottle of suppositories until I knew that I was able to have a complete pregnancy without a miscarriage. So I went through that, and it was like really tough because I was really worried about having another miscarriage because I had this surgery. And actually it turns out that the surgery is what allowed me to have this little boy right here, and I'm really thankful for being guided either spiritually or something towards getting like medical help with my situation, because I didn't know that that was even really a situation or like a bad outcome or a possibility, and why I either like might not be able to have kids or issues with infertility. Because me being honestly 24 years old, I didn't think that being infertile was really a problem for me until I had the surgery and figured out what was going on. And I'm really glad though that I took the steps to listen to my own intuition about what was going on with my body so that I could get the help that I really did need at that time. A situation that could have caused me possibly permanent infertility, which if I didn't have my son Raiden, I don't know what I would do, because I definitely kids are like everything, and they are like your heart and soul, and they're so important. So I'm definitely very thankful that I just followed my gut feeling. So on top of that whole situation, I am experiencing the same type of pains that I was experiencing before. So it is like the sharp pains in my ovary area, which to me, I was thinking for some reason I had surgery on my right side, but it was actually on my left, and I'm feeling like the tightness in my right, and then I'm feeling like phantom kicks below my stomach. I have taken pregnancy tests, so I'm not pregnant, but the possibility of needing another surgery concerns me. And I don't really know much about anything like endometriosis or anything like that. I've listened to some overviews about it, and I know it can involve like scarred tissue and such, and that it can cause infertility and everything like that. But I'm really concerned and wondering if that might be a possibility for me because of needing to have surgery just to have one child, and then experiencing this somewhat like sort of pain. So I'm really not sure about that exactly. I do have an appointment coming up on the 4th of this month. So I guess by time you guys are seeing this video, I think it might be the 4th, unless 4th is, I think maybe 4th is a Tuesday. So actually this video will be up the Monday before my appointment. So then I can probably give you guys an update in another video about their findings, if it's anything major, to conclude this video also. So I'm just gonna say that like, any women that are dealing with infertility, I definitely hold part of my heart with you, because that like short time of knowing that like not having kids could maybe be a strong possibility was very upsetting for me. So I reach out to every one of you and just know that like your baby or your rainbow baby or like anything is like right around the corner for you, and that everyone is meant to feel the joy of being a mom. Definitely, because it is a struggle. It's frustrating. Sometimes you want to rip your hair out, but you don't. I got a gray hair right here and I'm only 24, but like a child growing up is like the best thing to be there for. So I love you guys, and I'm just gonna end this video because I feel like I kind of explained what my struggle with infertility was like, but I think you kind of feel it because I'm crying a little bit, and I don't want to make this video like a pity party or anything like that, but I want anyone that is relating to either the possibility of not being able to have children, or a finding of something that could have prevented you from having children, or even someone that permanently is infertile, you are not alone, and everyone understands, at least I know I understand how much having a child means to you, like 100%. So I can like feel your guys' pain, or experience the joy of being able to have a child when you thought that you couldn't. Anybody can reach out in the comments below and like and subscribe this video for more content like this, and just so we can relate. And I want to hear from you guys about your own struggles and your own journeys. So again, I love you guys, and I will hopefully talk to you guys very soon.